Welcome back to Good Morning Sri Lanka. Morning still young and a lot of information which is also quite young that needs to be shared. Doctor, bringing back the question to you. Today if you take people, they do have an awareness level on HIV very minimal, and the first thing they realize is the fact that, oh my God, if I'm supposed to touch this person, would I be infected with HIV? Because as Mr. Kishore said, in a global spectrum, in a country like South Africa, Nigeria, or even you take an Indian nation, you need to have a pool of talent coexisting for you to get your productivity going. So in that perspective, is touching, is let's say having physical contact really going to make HIV contagious in that sense?
Basically, people must understand that HIV is transmitted mainly by sexual contact, because this virus is in high concentration other than in the blood, is in the sexual secretions, the sperms, the seminal fluid, the vaginal and the cervical secretions. Those are the body fluids in which the virus thrives other than in the blood. So when during unprotected sex, this body fluid exchange take place, and that is how the virus is transmitted. So if you take the globe today, majority of the transmission takes place due to sexual transmission. The situation is same in Sri Lanka. Majority of the transmission is through unprotected sex between a man and a woman, or sometimes it is due to sexual exposures between two men. So this is the main mode of transmission. Having said that, I must emphasize on the fact that once a woman who is in the reproductive age group, who is harboring the HIV virus, gets pregnant, she has a high risk of transmitting it to the unborn child during pregnancy via the placenta, then during delivery, and subsequently during breastfeeding. Now, to anybody will ask, are all mothers who are HIV infected have the risk of having a HIV positive baby? No, there is only a 15 to about 45% risk, but this risk is now brought down, because there are the drugs called antiretroviral drugs, which of course does not kill the virus, and it's not a cure, but giving these drugs to mothers can reduce the transmission. So that's about the sexual transmission. The other method of transmission is through contaminated needles and blood transfusions. I'm very happy and proud to say that unlike some of our neighboring countries, Sri Lanka has done very well in this direction, because transmission through contaminated blood is very well controlled in the government sector. I remember the way back in 1988, a very concrete decision was taken by the government to see that all bloods that are transfused in the government sector to be screened for HIV, and the donors to be educated, so that they take the responsibility also together with the state to do the blood test. So now what the state has done its role in doing the HIV test on all blood that is donated. People also have a responsibility. It's a dual responsibility. Exactly, because they must understand, they must be responsible when they donate blood. Because this same blood that they donate irresponsibly could be given to your own kith and kin. So this is how HIV is transmitted.
Which is a misconception. And Mr. Kishore, coming to you, which was obviously the point, the awareness levels are low. So hence the private sector coming into the picture. So Lanka Business Coalition, as of now, what sort of efforts has been taken to address this key cause, which would obviously be an awareness or an education?
Shafraz, few business leaders came together about 5 years ago and formed this coalition, learning from other countries, developed countries where the business communities came together and formed various associations to mitigate this risk. So learning from that, we came together in Sri Lanka and formed this coalition, and today we have over 70 members. And if you look at the market, so to speak, every single large organization is a member. We have companies like John Keel's, Haley's, Aitken Spence, all the banks, all the large companies are members of it. If you look at the workforce deployment, we have altogether about 9 million people in the workforce, of which about 5 million people are deployed in the private sector, formal private sector, right? So if we can bring all the business leaders together, we'll have the reach, covering 5 million people, right? So that's what we want to do. And so far, as the Business Coalition, we've been basically creating awareness, and we've been advocating policy implementation, within the organizations, so that these organizations will be in a position to recruit HIV infected individuals if there is a need to do that. And then once you have recruited them, to take care of their medical needs and make sure that right environment is created within the organization for them to cohabitate with the colleagues. And if we do not create that environment, then these infected individuals will be in a situation where their psyche, right, the way they look at the world, would be completely different, within which they can give the disease out to so many others. So there is that danger, from that perspective as well. But from an economic perspective, more than anything else, you have an obligation. This is another group, maybe due to their bad behavior, whatever, but they are in that situation. But we have an obligation to take care of them as well, from a social responsibility standpoint. So that's what we are committed to be doing. And as I said, we have all large organizations working with us, and we would want other organizations basically to join hands with us, so that we'll have greater strength to be able to do what is right for the country.
Definitely, which is a responsibility on the part of the private sector as well.
Right.
Yes. Moving on. So I mean, it's something any layman or any person, a generic person, the first question might be, okay, fine. Let's say an HIV, you are infected by HIV or AIDS for that matter. How would I know? How would I know that I've been affected by it, or I do even have it? We'll go to the technicals of it later, but at the start, for a layman, it's not about the technicals. It's about, do I have it or not? Even people who are watching it might be like, oh my God, really? So how would I know that I, or any person for that matter, would be infected by it?
That is the first question that will go across anybody's mind, because the virus gets into the body, and for a long period of time, maybe sometimes 10 to 12 years, 15 years, it will remain asymptomatic, that is without a symptom. Right? So during this period, how would anybody imagine that somebody has acquired HIV? But if there has been a risky sexual exposure, unprotected sex, frequent change of partners, new acquisition of partners, multiple partners, paying for sex, also buying sex, things like that, then you need to be alert. And after such an exposure, it is always good to discuss with a doctor and get your HIV test done. Having said that HIV test is not just people sometimes think that you go and get your dengue test done, and that covers HIV. This is a special HIV antibody test. There are the antigen tests also, but the common test is the HIV antibody test. Now the antibody test also doesn't become positive. Just say you had a sexual risky exposure yesterday, it doesn't become positive today. So there is a period called the window period, where the HIV gets into the body has to react to it and produce this specific
and
proteins.
That window period would be, doctor, if we are to have an understanding of how long would that window period be?
Sometimes the window period would be about 3 weeks to about 3 months, but we give allowance and say 6 months. But basically 93% of the people by 3 months they have seroconverted. But because we are a low prevalence country, not 100% sure, but 200% sure, we go up to the stage of about 6 months. So that is that window period. You avoid that. That's why you need to discuss and have a counseling, giving pre-test counseling information, and you are well aware of
Yes.
why you are doing the test
Yes.
and what the result is going to be. If you have just passed the window period, then there will be a repeat blood test. So all that the doctor will explain.
Yeah.
And then also the symptoms. Sometimes these symptoms are very non-specific. It might be a body rash, it might be a profuse diarrhea, not profuse, even a occasional diarrhea, and some people might have a little pain in the eyes, they are called retroorbital pain, or a chest infection,
Okay.
where you will not correlate it to
It's
HIV.
very generic.
Yes. But of course, if it is related to, if there is an association with a sexual exposure which has been risky, then you connect the two up and have a discussion with the doctor, get your HIV test done.
Yeah, great. So now, so that was a lot of information which even a layman for that matter would be like, okay, it's just a normal rash or anything of that sort. So now, it's time for another break, but before you go on that break, just ask yourself, and HIV is not you safeguarding yourself only. It's about safeguarding another person, because you not discussing it, you not coming out there in the open and knowing or inquiring about it could mean you are harming yourself, and you might be harming the people around you as well. We'll see you at the other side of the break.